Last year, I was in breast cancer treatment. I went through chemotherapy, a double mastectomy, and radiation therapy. And one of my pink sisters on here asked me for tips for radiation because she's getting ready to start in a couple of weeks. First tip, plan for fatigue. I was spoiled in that when I was in chemotherapy, I always had a ride. I always had a family member who took me to all my doctor's appointments and everything. I did not drive during cancer treatment until radiation therapy. And when I tell you I was sleepier than a mofo all the time, it was hard. I did not feel it like the first week, but going into that second week, I started to feel more and more fatigued. And it just got worse and worse as the process went on, to the point that, like, I remember dropping my son off at school one day and actually having to pull over outside the school to take a power nap before I drove to radiation. It was that serious. That fatigue, honestly, has still not gone away. I finished radiation last fall and I'm still not to my normal energy. Some people have told me that their radiation fatigue lasted for an entire year. Develop a routine so that it could be as efficient as possible with going in and out, and getting into that locker room, wearing clothes that are easy to get in and out of, always having my mini native deodorant on me because I couldn't wear deodorant before I got radiated. Routine also extended to what I did before they would call me back to get radiated. While I was sitting in that little waiting area, I was already preparing myself so that I could be calm and just even. So I would go through my yoga routine. I'd be doing my stretches and stretching my neck and my fingers, but basically just trying to get my body loose. Because once you get on the table, girl, you can't move. You have to stay so still. And for me, I breathe deeply. I do breath work. And even just me, normal breathing, they were telling me, you're moving too much. You got to stay more still. There were some times where I felt like I even just had to hold my breath just for them to get the laser to go exactly where they want it to go. Because it is important. It's very precise. So that's why they have you do it that way. Skin. Them burns, girl. You got to protect the skin. I did end up with radiation burns. They tell you don't wear any sort of moisturization or sunscreen 4 hours beforehand. I didn't always listen to that. I get eczema and I have dry skin. So I would put a very, very thin layer, not my normal Aquaphor, which I use all over my body because that's super thick, but I would use a thin silicone gel or calendula cream. I would keep those creams on me too, the ones that help with radiation burns, in my purse. So as soon as I was done, I put that cream on. The one that was most effective for me is made by a Black-owned company called Cocoa Buttery. Cocoa Buttery has a cream called Genesis. And when I tell you that thing got rid of my radiation burns in like 2-3 weeks tops, when they were telling me I might have burns for an entire year, get you some. She is on Amazon, or you can go to cocobuttery.com. This is not sponsored. I'm just telling you that's the truth. If you don't have access to that product, the second best thing that I used was calendula cream. Calendula is a flower, and it's very good for skincare and skin issues and rashes and stuff. So just putting on the calendula helped a lot. Be cool with your radiation techs because they will look out for you. That's just something I did throughout my cancer process. Is I learned all my nurses' names. Front desk people, I learned their names. I was on a first name basis with a lot. Well, not first name for me. They were calling me Miss Harris. But you got to get to know the people who you're going to be with because they will look out for you. You're going to get real comfortable with your techs because, at least for me, because I had 4 lymph nodes removed from my right underarm and I had cancer in the right breast. I couldn't keep the gown on once I was on the table. So titties out for about 5 minutes. So you're going to get real comfortable with the people who you're working with. So hopefully they're nice. Also get to know your radiation nurses. They are super helpful. And let them know if you have any problems. Like, don't wait till an issue gets super serious. Bring it up to them because they can always make adjustments or help you troubleshoot any of the problems that you're having. So just like with chemo, speak up if any symptoms or issues are happening that are unbearable because you don't have to suffer, girl. The thing that I wish I had known prior to radiation is just the amount of skin stiffness that I would experience. The breast surgeon told me that the breasts might shrink during radiation. I didn't actually experience shrinking of the temporary implant, but what I did experience is super stiffness. I learned this from the physical therapist. If you had any lymph nodes removed, if you've had breast cancer surgery already, the lymph nodes are part of a lymphatic system called the watershed system that actually goes throughout the whole body. So it goes like up through the wrists, up the arm, across the chest, I think down the torso. Don't get me to lying, but throughout your whole body, basically. And I had 4 lymph nodes removed. that also impacts the body because like you could be having back pain because it's all connected. Because of that, you have to really be on top of keeping your hands and your wrists limber, because there is a condition you could get called lymphedema where your whole arm will swell up. And that basically happens when the lymphatic fluid kind of gets stuck, where there's a traffic jam of lymphatic fluid. So doing wrist exercises, like just flexing the wrist like this, rotating the wrist, just making sure that you stay limber, shaking out your hands, super important, massaging your fingers. I just did whatever I could to not get lymphedema. And that involved just staying warm, not letting yourself get too stiff or not moving your muscles enough. For the longest, and even now, it's hard to lift my right arm without discomfort. So it's constant stretching, constant moving around. Like this right breast is so much harder than the left one, because the left one I had emergency surgery and so it's a more recent implant, but this one is just taut. It makes your skin very taut. I recommend, if you can, to go to physical therapy, especially if you're dealing with issues with your skin for radiation. Also, the physical therapist told me about dryer balls, and they are like the organic alternative to using dryer sheets. And if you roll that dryer ball on your chest, that helps break up some of the scar tissue and stiffness in your skin. But I wish you well on your journey, sis. You're gonna be all right. You were a survivor. We are survivors. Cancer sucks, but it does prove to us just how strong we are and how much we can endure. So I know for sure that it's gonna go well, and just holler at me if you have any more questions. Peace.